Okay, we are ready to start. I want to welcome everyone to the Postpartum and COVID-19 TheraZoom group. I wanted to introduce, I'm Raizel Keilson. I am the clinical supervisor of the Early Childhood Mental Health Program. That is at TICFA, which is a outpatient mental health clinic, which is part of OHEL in Brooklyn. And I really focus on children 0 to 5 and their caregivers. So we do treat a lot of postpartum and some pregnant mommies. So that I'm really passionate about attachment. So that's that early bonding with little children, especially newborns, and the impact it has on the lifespan and certainly families and systems. And I myself am also a mom, and I had a 2-year-old who kept me up late last night. So I feel like she's just trying to get me in the vibe of being postpartum and feeling like you're falling off your face from no sleep. So I'm right here with you. And this is my co-host, Rena Nadelbach. Oh, let me unmute you. Welcome to Zoom, everybody. All right, go for it, Rena.
Hi, everyone. I'm Rena Nadelbach. I'm a licensed clinical social worker. I've been working at OHEL for the past 12 years, and I also have a private practice in Cedarhurst. Most of my work is really done in schools, but I love working with mothers and their children. I happen to be really fascinated by the family systems and especially the impact of newborns on their families. I also am a mom and have 6 young kids, plus a 6-month-old. So I'm really, really excited to be part of this group.
Thank you, Rena. So just like a little tech stuff, which clearly we're all learning, I muted my co-host. I did mute all the participants. You can certainly, if there's something you want to jump in the middle, you can chat in the chat box and send a message either to everyone or to Rena. I am not going to keep my chat box open because I don't have a big enough screen to manage that. And then please, if you have a comment, a question, there's not a lot out there on COVID and postpartum. We want to hear from you, and we'll certainly open it up, unmute everyone, open up to the group when we are finished. I also want to let you know there are some people I understand that are on phones, so I am going to try to be mindful to read the slides just so that there are people who don't have the visual. So welcome everybody, and first off, Mazel Tov. You are here because you had a baby, or B'Shad Tova, maybe you're having a baby soon, and it's really a unique time. We want to talk about postpartum and COVID-19. So kudos to you for getting here. This is not easy, so already the fact that you logged in and you joined, you're doing a good thing for yourself, and already you're ahead of the game. Pat yourself in the back. Oh, there we go. The first thing I want to do before we get into COVID-19, I really want to take a moment to just establish what are the needs of a new mother that are true without COVID-19. So the first thing we know is physically, they need to recover. Your body had 9 months, hopefully, to prepare for a baby and to go through a lot of physical changes. So you need to recover, to actually give your body time to heal. The next thing we really think about, and this is in the postpartum field, we think about emotionally. There is a huge amount of hormones that come into your body during the time preparing yourself for the baby, and you have a big drop. At the time of giving birth, these hormones drop, and that triggers a sort of hormonal reaction. So it's not in your head, it's not made up, it is a real chemical reaction, an emotional reaction. And new moms are more emotional, and actually we know a lot of this actually gets triggered even during pregnancy, certainly by the 3rd trimester. So you might have been feeling already a little bit emotional. Emotionally, new moms need support. Socially, we know that it's important for new moms not to be isolated, to have social support, both for helping them physically take care of the baby, for helping them physically get their own needs met. So in general, nothing to do with COVID. When I'm working with a new mom, I'm thinking about social. Is she connected? Is she having social supports? And the last thing that we really think about that with any new mom is bonding with her baby. That's a huge need for her and her baby to have connection, and to them to start building this attachment that will, God willing, follow them through their lifespan. So this is pre-COVID, but I just want us to have like a baseline. So now let's jump right into it. And Rena and I were actually really struck by this picture. It's actually not from the United States. I don't know if anyone's calling in from Bangkok, but it's from Bangkok. And it's kind of that, like, this is what newborn babies look like, but yet something
for those of you, Raizel, for those who can't see what the picture is.
Oh yes, thank you.
Picture of 2 babies wearing like what almost looks like the hazmat face masks on, and they're being held up to the camera.
Right. So they have that beautiful, cuddly, swaddled newborn baby look and the faces of a newborn baby, and then they're wearing a mask. And I thought this kind of highlights, like, there is so much about being a new mom that we know about and that is normal and that is hard. And then let's throw in COVID-19, which is something we don't know a lot about. And really, we want to spend time talking about the mix of these two real stressors. So the first thing we were talking about looking at is this first statement. This isn't how I planned it to be. And I think if any of you could remember that moment you found out you were pregnant or you shared your pregnancy news, I'm sure you weren't talking about, and I don't want anyone to help me, and I don't want anyone to come to the house, and I want to also possibly make Pesach with my 2-day-old baby, and I want to do everything myself. I'm sure that was not anyone's plan. That from the time you went into labor, had your baby, and even now during postpartum, this is totally not how you imagined it. And I want to acknowledge that because I think that's important when we think about your birth story. Everybody has a story about when they gave birth, and we know that the further what you expected, so I think a lot of people, a birth plan, I'm going to go to this hospital, I'm going to have this doctor, maybe I'm going to be at home, and I'm going to have this person help me. And then when that gets switched, and suddenly, it can impact your recovery. We know that if a woman was planning on, let's say, having a home birth, last minute she's rushed off to the hospital for a C-section, or even she's in a hospital, she's planning on having a regular birth, she's rushed off to a C-section, that sort of change in what she expected can impact her recovery. So here we are, we're telling all of you, you all got thrown into something that was not part of your plan. That is going to impact possibly your recovery. And the other point I was really trying to highlight here is that this is not just with birth, but of course, certainly with this sort of story, is that your expectations were here. And then reality was like this. The bigger the gap, and for those of you on the phone, I'm holding my hands apart. So expectations are higher. The bigger the gap between your expectations and reality, that's the bigger you're going to have room for disappointment. So in therapy, we talk a lot about bridging that gap. So the closer your expectations are to reality, the less disappointment. But we couldn't prepare for this. So everyone's going to have that gap, and they're going to be impacted by, this is not what I wanted, this is not what I planned. So what do you do with that? And this, I'm going to pull a little bit on what we know about the postpartum period and what is helpful to women who are postpartum, is to tell your story. If you think back maybe to if you had other births, or you can recall talking to someone who just gave birth, what do they want to do? They want to tell you every detail. This is what happened to me. You walk into Shalom Zachar, right? And the woman's like, first, my water broke, and then we ran to the Hatzalah, and everyone has this story. And actually, what's fascinating is that this is a biological need to tell over this story. A woman needs to share this story to make sense of it. Going through birth is really a unique, and for some people, a little bit even uncomfortable, for a lot of people, really an uncomfortable, certainly a painful experience. And we need to talk about it. It's a way of healing, a way of making sense of what happened to us, which I think is fascinating, that biological need that you just want to tell everyone. And even though you just told that story and your husband's like, I heard this 1,000 times, or he's thinking, this happened 7 years ago. Why are you telling this so animated again? It's because this is a biological need. You want to tell this story again so you can make sense of it. And in therapy worlds, we think of it as that's how you process it. You take something that's big and chaotic that happens to you, and you tell it over, and you start to make meaning, and you start to file it in a part of your brain that is memory as opposed to highly triggered. So this is a really healthy part of healing. Now let's add COVID, what we just said. We said that your story is really new now and has a lot of possibly disappointments that you really didn't anticipate it, on top of the regular stress of going through giving birth. And now you need to tell your story, but nobody's coming over. What we want to encourage, and this is why we chose this picture, is that you should tell your story. When people call you to say, oh my gosh, Mazel said, how are you doing? Tell them from beginning to end. If you feel that need to share it, that's a natural, healthy need, and you should. So when people reach out, it's not maybe happening in the way that it more typically happens, where people are coming over, or we're having large gatherings, whether it's a Shalom Zachar, or whether it's a Kiddush or bris. But if someone reaches out to you, share with them what is going on. Let me move. So I'm going to hand this over to Rena.
And let's just talk for a minute about the things that you might have lost out on because of this COVID crisis. These births were not what you expected 9, 10, 11, however many months ago. But it could be that something that you were really missing out on was not having your main support person with you at the time of your delivery. There were stories about people whose husbands couldn't come, maybe because of the hospital policy, maybe because they themselves had COVID, or there was no one to watch their kids. So their husband couldn't participate and couldn't be there with them in the birth. That's huge. That's a big thing. That's something that you really did lose out on. 24-hour hospital stay after you give birth, that's pretty unusual. That's something that really could be something hard when you feel that your medical care is somewhat compromised and maybe you weren't ready to really leave the hospital at that point. Wearing a mask in labor, that's something that's really, really unique to this situation when, our faces show our expressions, and that's part of our communication. When you're wearing a mask, you're hiding half of your communication ability, and you might not have been able to properly express, if you were in pain, or even being able to read what the nurses were feeling and what they wanted to communicate with you. That's huge. That's a big part of your delivery and part of your labor. The next thing could be not having your parents or your in-laws meet this grandchild. Your family meeting your newborn child is a very big part of your birth, and having them just be a part of this experience. And they probably couldn't be there and may not be able to actually hold this baby for some time. For those of you who had a boy that no one was able to come to the bris, a bris is a really emotional time. It's a time when you might have really wanted to have your support people there. Maybe this baby was being named after somebody that was, really important in your life, and you wanted people to be able to share that with you. And in this situation, it just didn't allow for that. And if you had a girl, that's a really interesting situation for how you even named anybody. And then all the help that you were expecting. Maybe you were expecting to have people send you meals and people weren't able to send you meals. Maybe you were in a situation where you couldn't have anything that was homemade. People weren't able to get to stores. They weren't able to. That's something that you really lost out on. And then there's Pesach, which is a whole new ballpark that for some people, having a baby or being due around Pesach time is guaranteed that you are not making Pesach and that you are going away. And suddenly, with very little warning, because don't forget, this happened so close to Pesach, the shutdowns, the lockdowns, and you suddenly had to be thrust into making Pesach, which may be something you never did before, or definitely were not expecting to do this time, all while either being 9 months pregnant or recently postpartum. That's big. Those are big things to have lost out on, and that will really impact your own labor story and your birth story.
We want to encourage you to use these parts of your experience and share it. Share it with other people. It's real. Include this in your narrative, in the story that you're going to tell, in the birth story.
But at least you have a healthy baby. That might be something that people have been telling you throughout the crisis, because unfortunately you're hearing so much about death and sickness. So people might be saying to you, but at least you have a healthy baby. Or that might be something that you keep saying to yourself in your, while things, this baby is crying and your house might be a little bit chaotic. You might be saying to yourself, but at least I have a healthy baby, with a sense of guilt of like, how can I be feeling stressed or sad, for all the things that I lost when, at least thank God I have this beautiful, delicious, healthy baby. But people are complex, and you can have two different emotions at the same time. You can be feeling sad about the things that you lost. You can be pissed about what's going on in your house. And you can also be feeling grateful that you had this healthy new baby. Those two things are not mutually exclusive. You can switch it and say that I have this beautiful baby and it's hard. You can switch the but. There you see it for those who are on the phone. What it actually says on the slide is, but at least you have a healthy baby. And we want to change that to, I have a healthy baby and this is hard.
What we really want you to know, and this is something we do a lot in treatment and the work we do, is that when you suppress something, so you say, I shouldn't be upset. Look at this beautiful bracha I have in my life. I shouldn't be irritated. I shouldn't be, at least I had a healthy baby to have a birth. Why am I so upset that no one came? You suppress it. What we know is that suppressing an emotion doesn't make it disappear. It makes it pop out in another way. So you might be more irritable towards your husband, towards your children. You might just find that you don't have patience for something, and that's typically from suppressing an emotion. So give it room. It's real. You lost out on opportunities that you imagined. You feel disappointed. and you still feel blessed. These both can exist at the same time. And think of this, you're on this group with many other women who are going through this. So you were certainly not alone in wondering, how do I manage the stress of having a new baby during COVID-19? So we wanted to really just like give a moment and acknowledge you and give you permission to acknowledge how you feel.
This is a special shout out for the first time mommies. There is nothing like having that first baby. Your body is definitely going through the biggest change that it really ever will by having that first baby. And there's a lot that you may feel like you need to learn or things that you don't know. Having your first baby during this time might feel really scary, and the fact that like we're all being socially distanced. The fact that we're being distant does not mean that we have to be completely isolated. And therefore, you should reach out and you should call people and ask questions and be able to find out what you need to know. What's really interesting is that just about anything you acquire comes with a set of instructions and comes with a manual. If you buy a plant, they tell you how to take care of it. You get like a card game, there's instructions for what to do and how to take care of it. Your baby did not come with a manual. It probably should have. So for anything that you feel that you're lacking, there are people there that do know, and you should ask. Ask. You can ask, call if it's a parent, a mother, a sister, even your healthcare provider. During this time, a lot of doctors and pediatricians were having policies that they were only allowing one parent to come to the visit, the checkup. So it's a little overwhelming, and it's hard to take in all the information when you're by yourself. And sometimes you need that second set of ears. So if you feel that you lost out on something, if you were there by yourself and your husband went instead of you, and you think that you really didn't get all the information, call. They're waiting for your phone call. They want to be able to answer all the questions that you have.
Yeah, we're going to talk to moms who have more than one, but those first-time mommies, we want to encourage you really. There's a natural process of people coming and gathering when someone has a baby, whether that is you are planning on moving in with possibly your mother or your in-laws or a person who is really going to show you, or just even the visiting. People come and they just say, oh, let me show you how to hold the baby while you nurse. And it's not even that you ask, but there's just like this give and take that happens when you see someone with a new baby. Everyone has a little bit of advice. Some advice is crazy, but there's a lot of really good advice that you can get, and you're being denied that opportunity. So go ahead and ask. Chances are your husband's not going to have the answers. Call people. No question is too small. Go ahead. Really, really mazel tov and ask questions.
Okay. This next slide is really addressed to the moms who have other children in their homes. There are a lot of words on this page, so for people on the phones, you can listen closely. For everyone else who's trying to read all this, I'll read it out loud to help you all out. This is a word problem. Ready? One mother has 5 children, all born after the age of 2005. She had a baby 4 weeks ago. Her children are all home 24 hours a day, 7 days a week. 0 people can help her with her kids. One husband has to work 7 hours a day, 5 days a week, and her children have 4 hours of Zoom school 4 days a week, minus the 2 classes that have to be rescheduled. How many seconds a week can this mother be alone? What's the answer?
And we want, whoever has this answer, we are going to stop right now, and you're going to continue this lecture because we actually don't have this answer. This is a hard question. And I know for some of you, this is very triggering doing Zoom school and having to think about word problems. So I apologize, but yeah, it's a lot. It's a lot. So what we were looking at as the equation when you're thinking about all the things you might be juggling as a postpartum mom during COVID-19 is that you need to take care of yourself. So it's not probably something new we're saying to you, but I want you to think of it like this. When you take care of yourself, it is equal to taking care of all your children, even your husband. When your needs are met, and Rena's going to talk a little bit about what needs really to focus on, you have the strength and ability to meet others' needs. When we are on empty, and one of the ideas that we sometimes use in some of the work I do is a cup. So when our cup is empty, we can't fill up anyone else's cup. So you need to fill up yourself in order for you to pour and to give to your children and to your husband.
So we started by kind of going through the basic needs of a new mother. And I have to tell you that just because of the COVID-19 crisis, those needs didn't change. You only have the same needs now during this crisis as you would have had you given birth at any other time. So just to go through some of them, and especially for the people who aren't looking at the visual, I'll read through it. We have a nice acronym because acronyms are helpful, especially when your minds are filled with other things to keep in mind. And the acronym is NEST, N-E-S-T. We're familiar with nesting and those concepts at the end of your pregnancy. So here we're going to bring it in on a postpartum level. And what NEST stands for is the N stands for nutrition. You need to make sure that you're eating and drinking properly. We're not talking about gourmet meals. We're not talking about, maybe the best diet that you can come up with, but a good enough diet. Usually what's recommended is like lean proteins, whole grains. You do as best as you can. It's not a time to crash diet because you want to make sure that you're taking in enough calories so that you have the energy that you need to recover to take care of yourself, your newborn, and as you see, the rest of your family. The E for exercise. Okay, so once you get the go-ahead from your doctor and your practitioner, and they say that it's okay for you to begin to exercise, moving and getting your heart pumping is good for your body. Some of those things might just be recommended to like start walking, slow stretches, whatever it is that works for your body and whatever you need. But that is good, and that is something that you could try to incorporate even during this time, especially now the weather's getting nice. If you could walk outside, the sunlight is really helpful. S stands for sleep, which is probably no one needs to tell you that you need sleep. We need sleep to function. Sleep is really, really important because it affects just your mood, but also your biology in terms of that your brain needs to shut down so that it can continue to heal. When you're lacking sleep, you're going to notice that your mood changes and you're going to become more irritable. It's going to affect your decision-making skills. So you really want to make sure that you have adequate sleep. You've heard to sleep when the baby sleeps. I know that always doesn't sound like it's so practical, but it is something that you should try to do to be on the same schedule as your baby because that's what your body needs. The T stands for time for yourself. So time for yourself does not mean you and your baby. Time for yourself means time all by yourself, which is probably one of the hardest things at this time when everyone's together and all together at the same time. But it could be however the quality and the quantity that works for you. So even if that's just taking a shower and being all alone by yourself and blocking out the noise, then that is time for yourself. And that's something that you should also learn to incorporate every single day that will quickly help your recovery and your healing.
Thank you. So we're telling you what you need. How do you do it? So what is true probably for a lot of people in COVID, but certainly for a postpartum period, is you need to redefine your priorities. So if you have, this is how I function when I'm not postpartum, this is how I function, and for those of you on the phone, I'm lowering my hands. This is how I function when I'm postpartum. This is how I function, and again, I'm lowering my hands again, when I'm postpartum during COVID-19. So you really want to acknowledge there's a lot going on and you might need to redefine your priorities. And here's some ideas we thought of that might help you make sense of, okay, how do I want to function? I know what I need to get done. How do I want to function? So the first one was develop a mantra. And for some people, this can be a religious phrase that gives them strength and feels empowering or helps them feel connection. For other people, it can also be like, this is what is most important. So for example, one person might say, it's really important that mommy gets better. And that's kind of their mantra and their filter. So if there's something that's going on and it is going to not support that goal, it's very likely it should be pushed aside. So how would that practically play out? It might look like, mommy is not feeling well. She's feeling really weak and exhausted. And so-and-so didn't go to Zoom class today and didn't do any of their work. So I could stay up and help them with Zoom class and really catch them up, but I'm not feeling well. And my real big goal is that I get better physically and I feel better. That would be a filter. And the Zoom class, and everyone needs to make this own judgment call, but that would be an example of two things that really are competing. You got your COVID postpartum filter and you're saying, this doesn't really support my main goal. The next thing we were talking about with redefining your priorities is take it day by day. And when I talk about day by day, I mean hour by hour, minute by minute, moment by moment. Sometimes it feels too much to think, how am I going to get through today? So you got to scale it back. How am I going to get through this morning? And if even that feels too much, say, what do I need in this moment? And often in that moment, it might be something really small there. I just need to take a deep breath. I just need to see what time it is. And okay, I can do that. I can check the clock. Just take it, move it slow. I think with COVID-19, none of us can even think about what a month will be like. So you're not alone in feeling like you can barely imagine next week. This is true, I think, across the board. So certainly if you need to take it slow, if you need to just, how am I going to get through today, this morning, this moment? Give yourself, that's the focus, that's where I'm at. The other thing that we were talking about is you can't have everything. And what will you let go? It can be a choice, or it cannot be a choice. And how I think of this in the visual is that, you know, you have an oven, you have 4 flames, and you have 5 pots. 5 pots are not going to fit on those 4 flames. Something is not going to get cooked. Now, either you pick what you can't take care of, or it will pick itself. So again, let's go back to the mom who says, I can't sleep. I don't have time. So she chooses not to sleep. What she might be giving up is her mental health. She might be giving up her ability to cope, her ability to manage her emotions. That might not be really worth it. So then can you let go? And some of the things, and again, for every person, this is different. And it's really something you need to look in internally. But some of the ideas Rena and I were kind of talking about is housework, which is interesting. We were saying like COVID-19, no one's visiting. So there's a little bit of a, no one's knocking and saying, oh, surprise, I came to see your baby. So it can be a mess. To what you're comfortable. I know for some people that can be just so overwhelming, but there's certainly things that you can say can let go. Certainly meals. Again, we spoke about nutrition. Nutrition is not a 5-course meal. Nutrition, it can be eggs, that's a protein, can be cheese, that's a protein, that's good for you, that's good for your family. That would be about letting go. I really want to cook a really good meal. I know my kids love this thing, but I also don't have the energy to go stand online to get into the store, or I need my husband to be home. I don't want him standing online to the store. So that's what I'm going to let go. Supper is going to be simple. And the last thing we were thinking about when you're thinking about priorities is pick your battles. Yeah, there are things that are important. Like maybe you didn't want your child to have that much screen time. Or maybe you really would like your child who's a weaker student to be a little bit more participating on the Zoom class. But this is a battle. Now I'm going to have to really use my energy to get this child engaged, to retutor them, or to really stop that child on the screen, and I just want to lay down. Now is not the time to resolve bigger issues. Now we, highlighted some areas you really do need to focus on for right now. Save your energy for those areas. Again, your bonding, your physical and emotional health. Rena, do you want to add anything to?
I think it's really important to really see what's important to you. And to really make sure that you're conserving your energy and then go back to what your needs are, and to make sure that you're fulfilling all of your needs so that you can recover. Also, when you're picking your battles, you can view that as something temporary. It's something that you're doing right now. Right now, you need to focus on your recovery, and afterwards you can go ahead and build your standards back up to where you want them to be.
Right. It's not a forever. Doing all or nothing. I did, like I had mentioned in the beginning, I do work, Rena and I are both social workers, and I do work in the fields. I just wanted to mention postpartum anxiety and depression. So if you're struggling to function, either to meet your own basic needs or your baby's needs, if you find you're very, very preoccupied with nonstop worrying, you should consider reaching out to your obstetrician to discuss getting evaluated for a postpartum mood disorder. It can be either presented in a more depressed, but it can certainly be a more anxious presentation. In OHEL, we are doing telehealth, which is basically therapy similar to what we're doing right now, but not with a lot of people, just you and a therapist. We are doing therapy through the computer, through Zoom and other platforms. So you can call. This is specifically though for people in New York City and the 5 towns. The number is 1-800-603 OHEL, but there are a lot of resources if somebody would like, wherever you are, to just get evaluated and see if maybe you could use more support. So we said, there's kind of this, I feel like false advertisement maybe. We said it's going to be a group, and we do want to pay attention to that. because we do want to hear from you. So what I would like to do is, we have a couple questions, but I would really rather open it up to the group. So I'm going to unmute, and we're going to have, there will be two options. Either you can type in your question to Rena. I don't have it open right now, so I wouldn't necessarily see it, or to the group, or you can speak up. So I am going to, you know what, I think I can mute you, but you can unmute yourself. That might work better. All right, I'm gonna try this again. So I invite anyone who would like, I'm gonna unmute. Those of you who don't have a comment, if you can maybe keep yourself mute, but those of you who would like to speak, I invite you to, if you have a comment, maybe something that's worked for you, or a question, please feel free to share. I missed the beginning of your question. You're saying it is normal, people normalize feeling like a low mood. You wanna know what you could do to elevate it. I would say match your mood. So if you're feeling low, choose an activity that matches it. So maybe it's reading, maybe it's, you know, if you have the opportunity laying low, don't fight it. And there's two truths to hold. Number one, this is a truth, whether you're postpartum or not, most likely it will pass. If we're not talking about a real disorder, feelings come and they pass. They're like waves. Okay, I feel like I have no energy. I feel like anything someone says to me makes me feel like I'm gonna cry. This will pass. I'm going to match the mood. I'm going to match my mood. So I'm not going to do something that requires me to pretend to be happy. I'm also going to give permission. Like you said, which is true. It can be postpartum, just the hormones. I'm easily triggered and irritable. Don't judge yourself. Flow with it. Is that helpful? Did anyone else like to ask a question, or Rena? That is such a great question. And you know what? One of the things Rena and I did was we called people who are postpartum, and this didn't even come up. And it's that reality of like, wow, I didn't even think of that. And I'm so glad you brought that up, because I am confident that you are not the only one. And that is an excellent question. You know, being supported and being with other people is such a protective factor. And here you are in this vulnerable time, physically and emotionally, and not being connected. I know Rena actually had used this phrase, so I hope it's okay, Rena, if I borrow it. Although we are socially distancing, please don't socially isolate. If you can, please, and I don't know what technology that you have available, but if you do have internet, Zoom, connect with people, really try to have connection, because that's so important. This is really a unique challenge that you're describing to this time. And it has its own really, really hard parts, doing this alone, being alone. Please try to find ways to connect. First of all, you came on here, and I hope you're realizing there's a community of people who are going, maybe not through exactly what you're going through, although I'm sure there might be, and to find other connections, whether it's friends, family, connect them through the phone, through Zoom. Giving yourself permission and acknowledge that this is hard.
I have a question here from somebody. Okay.
Yes.
At what point should you get evaluated for postpartum depression? And where do you draw the line and recognize that you may need more help? So how do you know really what's normal and when you really need to call for help?
Okay, so I'm going to talk about it generally, and then we'll maybe touch a little bit on COVID. When we talk about postpartum depression and postpartum anxiety, so depression, you're really looking at inability to function. You're not going to function your regular when you have postpartum.
Can you mute everybody? Raizel, can you mute everybody while you're doing the answer?
Yes. The first thing is the depression. So it would be a really pretty serious impact on your ability to function. If you feel like it's more, and trust your judgment. If you're feeling like this is more, I'm more upset, certainly if this is your first child, you might not know if this is normal, so ask. There are screenings that can be given, your practitioner can help you. You're just feeling like you can't function. With postpartum anxiety, we're looking for a preoccupation, so you just can't stop worrying. It's really normal to have intrusive thoughts. This is normal for anyone, but certainly postpartum, there can be an intrusive thought, a worry that pops into your head, but then it goes. So it would look like this. You think it, and then you're like, oh, no, that's probably fine. Or you move on to something else, and now I'm bringing it up, and you're like, oh, I remember I did have that thought. That is not postpartum anxiety. That's regular, normal anxiety. With postpartum anxiety, it would mean that you can't stop thinking about it. Either you're taking steps to make yourself feel safe from that thought, or you just can't stop. You are completely preoccupied, and that can be postpartum anxiety. These are relatively common postpartum complications, and they're super treatable. So I really encourage people, if you feel like you're having a hard time, please reach out. Treatment can be quick. Certainly therapy is been shown to help and to work, and you don't have to feel this way or really live this way right now. Now, specifically, and like I said, OHEL is offering treatment through Zoom. It's not perfect, but it's certainly accessible and it is working, and we're getting good results. I'm sure that there are many other places that are doing it. As far as a little bit on the COVID, I did see, I think that somebody wrote about COVID-19 and worrying about themselves getting sick or their baby getting sick. So if you speak with your practitioner and they tell you that you're okay or your baby's okay, and you can't let go of that, that can be a sign that it's a little more than regular anxiety. But if you feel like it pops into your head, and I think these things are popping into all of our heads, and we are taking steps that are appropriate. We have appropriate levels of anxiety, like washing our hands, like social distancing. That's okay. But if you're feeling like it's beyond that, and it's a point where your behavior is not matching what everyone else is doing or what is your doctor or practitioner is doing, you might want to explore getting a little evaluated. Is that helpful?
And Raizel, another person asked for some tips.
Huh?
Yes. I'll mute it again. You know what? I'm trying to figure this out. All right. What was it, Rena?
Somebody actually asked for some tips on how to just deal with anxiety, and maybe that's an important thing for us to just to touch upon, just some normal anxiety. And we spoke a lot about your physical needs in terms of your recovery, and paying attention to those needs is like a great way to start in terms of addressing anxiety. Even just noticing your own breathing habits, to take deep breaths. If anyone's familiar with deep breathing, regulating how your body feels is just like the beginning to help deal with some anxiety. Raizel, what other tips specifically can we give these new mothers?
Yeah, with anxiety, one of the things is not to ruminate, so not to sit and think about and think about and think about. So if you're finding you're doing that, distract. Get yourself busy with something else. Possibly something, and I'm like thinking about this as I'm talking, that requires a little bit of energy. Anxiety is it's an energy evoking emotion. So although I certainly don't want you running on the treadmill, I would think, maybe you're getting involved in an activity with a child so that you can't sit and ruminate, or you're getting on the phone and you're talking with someone and you're distracting yourself. These are good ways to cope if you're finding yourself spinning rounds and rounds on a certain worrisome thought. I am noticing that we're getting in, I was able to open the chat some more questions. So someone asked, how do you deal with resentment to people who weren't willing to come help when you needed to run to the hospital? So you're saying other people, you feel resentful that you needed more support. I think this is than people were able to offer. Rena, do you want to respond to that?
I think it's a difficult time. I think it's a really difficult time. I'm not 100% sure what the question was asking. Does that person want to clarify?
Okay, so I guess I'm thinking like it can feel like, again, I think of this maybe similar to the expectations that like, we had a plan and you were going to watch my kids, and then you are afraid to come and watch my kids, and now maybe my husband couldn't come. So I think the resentment would maybe also be translated as hurt, and that, again, that gap with expectations. And this is real disappointment. This is real loss. It may be to find a place to make meaning of it. So for some people that can be religious, for some people that can just be talking about it and just like being like, wow, this was a really crazy time, but getting at peace with it. That would be one of the things I would maybe consider. We got some questions actually about dads and we did want to talk about that, Rena, right?
Yes.
You're home all the time, possibly with all your kids all the time, and this is a new reality for you and dad. So I think some of the things people are at, is that maybe they need a little bit support from dad. So there were two things we really wanted to highlight. Number one is, so we spoke about today what your real important needs are regarding your health. And if you can prioritize and say, this I'm not going to take care of, but maybe he can take care of it. The best way to maybe have someone take care of something, and this can go for husbands, this can go for children who are teenagers who you think maybe could help, is don't rely on mind reading. You know, when you walk into a room and it's 9 o'clock and everyone has school at 9:30 and no one had breakfast, you might already be able to say, why wasn't breakfast served? That's in it. But for some people, for people who are not used to being in that role, that didn't even cross their mind. And even though your husband's sitting right there, it didn't even cross his mind that they would need breakfast. So the best thing is to really articulate. So for example, let's go to that story. She's going to stay in bed. She might say to her husband, I really need you to get the kids dressed. I mean, I know no one's getting dressed these days, so of course that might not be it. I really need you to make sure everyone has breakfast. That would be cereal and milk before they start class at 9:30. And what I also wanted to do is lower your expectations. So when you come downstairs and breakfast was eaten, which is great, but the milk is still out and the table is still filled with bowls, you're going to do again that request, and you're also going to remind yourself this is a new role for him, like it is really for all of us. And he didn't realize that when I say give breakfast, I meant feed and clean up. So either you can go back to that first tip, which is just saying it would, and this is also a good way to just bring it up, not like this is how you do it, but to say it would be really helpful to me, or I need you to also clean up the meal when you serve it. The mess is so hard for me to look at right now. That would be a way to both set expectations that are realistic and also to convey your needs.
Here's another question. Someone is asking about colic and how to handle a colicky baby. And this is actually an interesting question, specifically during this time when you have less help and you have less resources maybe available to you. It's really, really important that if you feel yourself getting really worked up because that baby just won't stop crying and won't stop screaming, and really that can make you really nuts. I've heard from somebody who once said that the only thing that's harder than having 10 children, and she knows because she has 10 children, is one screaming baby. It can really rattle your nerves. Pass your baby over to someone else in the house if you can. If you can hand over that baby, even just for a little bit, to a husband, if you have an older child, even a younger child, but can rock the stroller for a few minutes and just walk out of the room and kind of displace yourself just for a few minutes, the baby won't be hurt from crying. The crying itself is not going to hurt the baby, but you need just a few minutes to not hear it. So kind of just to take yourself out of that for a few minutes and to take a few breaths and to take a break, if you can give yourself a break, to get a little bit more energized. But having a colicky baby is really tricky, and that can cause anxiety. So to keep that in mind, that you're feeling anxious because of that, and then try to implement whatever you know about anxiety, or call for help. Call your doctor and find out for tips, or call somebody else who you know who's had a colicky baby to give you that support, and just to feel like, okay, this has happened, how did they get through it, and know that there is an end in sight.
Yeah, and what we think about with colic is also the attachment that if you're feeling, which of course, holding a screaming baby and feeling like I am at my wit's end, your beautiful child is so attached to you, they can feel that. They can feel that this is so much. So when you take that break and you put that baby down and you walk out of the room and you take that breath to regulate yourself, the child will actually pick up on it when you bring them back. It will not solve colic issues, but just to give you a better place to try to regulate. That's the idea of co-regulation. You and your baby are regulating together, but that is really hard. And reach out for support, for help. Let people commiserate with you.
Another question that we're getting, and this is really common, is, will this stressful COVID situation, and everybody here had a stressful COVID delivery, will this affect my baby? And it's really important to keep in mind that right now, all your baby needs is you. So as long as your baby's needs are being met by they're being fed, they're being nourished properly, and you're bonding with them and giving them that attachment that they need, your baby will be okay. Then they might just even be a stronger COVID baby from this.
Right. We don't know, but what we do know about babies is that baby and mommy, and that's all the baby needs. The baby obviously doesn't know the facts and doesn't know the risks. And if they have you, they have everything. So as far as worrying about like a long-term impact on your baby, I don't know that there's anything you need to pay attention to outside of just being there and bonding. And for some of you, actually, there will be an interesting benefit because maybe you were going back to work after 6 weeks, and here you having a little bit longer time to physically be together and be bonding. Was there anything else? I want to be mindful to, and I know for a lot of you, I really thank you for coming. It's not a easy time, and we actually debated when is a good time for postpartum mommies, and we realized there is no good time. So for those of you who came, we know that you put something aside to get here. Is there anything else maybe